Two, one. Hi, guys, and welcome. Hi, Caren. Thank you for joining me.
Hi, thanks for having me.
Awesome. So, we are going to be chatting about a whole horse journey of neuromuscular repatterning today. We might have some internet issues on my side. So, if you guys can't hear me or see me, please let me know in the comments and we'll see what kind of backup plan we can make as we go through. But that is the nature of being online, is sometimes we come up against the challenges of technology instead of the joys. So, Caren, as we get started, will you please introduce yourself and tell us a little bit about what it is that you do?
Hey, well, thank you for having me again. I'm excited about this. I am a registered veterinary technician here in Canada. I've been a technician now for 19 years, and I am what I consider to be like the forever student. So I have had quite a journey in my education over the years. Forever attending all of the continued education sources that are out there. And I feel like the biggest catalyst for me for where my personal practice has developed into like a soft tissue sports medicine kind of things is that most of my own creatures, both small animal and large, tended to not follow the textbooks on point. So I felt like I always was seeking new answers and ways to support my creatures at home and for supporting clients as well. So I've had a very mixed background of conventional veterinary medicine and some alternative veterinary medicine. And my current practice of the last 4 years has been working for myself to work with clients one-on-one for rehabilitation cases for both our small animals and our horses. And today our focus is to come and discuss one of the equine modalities that I use, which is Equi-Bow, which is a soft tissue hands-on technique where we're going to work on repatterning the neuromuscular system for optimal health.
I love it. I love it. So, guys, if you are joining us live today, it's really great to have you. Please let us know where you are from and what your interest is in today's topic. It will be really great to know who's joining us. If you're watching this as a replay, hashtag replay, and any questions that you have, share your comments. We're going to be checking in over the next few days on this live feed, so it will be great to hear from you. Okay, so let's talk about why is neuromuscular repatterning necessary for our equine patients. I completely agree with you in that. In my own, herd of horses, I've had so many that have just, I haven't had solutions for the problems that they've had, and I've had to be creative in how I find those solutions and educate myself further. So, why is neuromuscular repatterning necessary?
So it's really important for our all bodies, but it's really integral for optimal homeostasis. So the body keeps score. I don't know if anyone's kept up with some recent literature on the human side of that, but on our animals, we can see the same. So we can get stuck in different holding patterns or compensatory patterns from a soft tissue and a bony perspective. And so we need to come along and offer a little bit of a catalyst or facilitate some reintroduction of normal patterns and movements in the tissues of the body. So we're going to work with some hands-on techniques to start to bring some awareness to the nervous system as to how that body maybe is in a little bit of disharmony or dysregulation. And with that, we're going to restore normal order. The reason it's so common and why we have so many challenges with our horses is that life in itself happens to all of us as bodies. So stress factors, environmental factors, movement behaviors, these are all repetitive motions where the body is sort of recognizing like, oh, this is the state I'm in. This is the repetitive motion. This must be sort of quote unquote my normal. And so depending on how long a health challenge or an environmental factor has been at play, we're going to see that body start to kind of hold that pattern as its new neutral, but it may not actually be the true proper biomechanics for that body. So when we think of reasons for that, I quite often like to walk clients and students through just like life in itself. So if we think environment stress factors, it not necessarily like emotional stress, but like just the day-to-day life. Are our horses living a fairly sedentary life? Do they have freedom of movement? How long are they stabled? When they're stabled, what does that like holding posture look like? And I know that it's easy with a lot of the information that's out there now to think, oh, well, horses who get more turnout or horses who have more movement outside are going to be healthier. But even in that environment, there's so much biofeedback there. So, what does that terrain look like? Are they walking away from their hay resources or their pasture and going to the water? How many footfalls do they have in a day, or are they very little? What does the footfall terrain look like? So what is the ground source? Is there a slipping repetitive motion or a concussive force? And then we also, of course, have like all of the ages of those horses in those particular environments. So there's this constant feedback from life in itself to the body saying, you know, this is the state that we're living in. This is how we're currently traveling. And we want to make sure that that's at optimal function. We also have the challenge of like repetition in our horses' lives. So even the sedentary horse that is out in pasture all the time, maybe their habitual patterns are very consistent. Maybe they're traveling on a super flat, perfect surface. I think one of the biggest challenges we have as equestrian management teams is we've built like these perfect quote unquote paddocks that may be like accident free. But with that, we actually see a reduction in like the way those horses are traveling up through all those joints. So if we're not traveling up and down different terrains or elevations, over logs, different foot surfaces, we're actually still training the body to be very flat and perfect and not going through what nature kind of designed some of those joints to do. And then the most common theme that I find most professionals are used to is they think of the sports athlete. But those horses out living their young horse lives, or those seniors, they still have a repetitive lifestyle. So is it as normal as it could be, or is it very repetitive and stuck? And then our sport horses, I feel like in the last 10 years or so, we're seeing so much of an improvement in cross training, but that can be in itself challenging as well. So making sure that our horses are, you know, going through different motions and patterns so that we're trying to optimize their biomechanics. And then nutrition, I put into that environmental stress factor. And some of that comes from my background as a veterinary technician, where nutrition was a key part of some of my continued education, is that honestly, at the end of the day, any health disease, any rehabilitative perspective from a muscle or soft tissue resource, we can't heal the body if at the cellular level it's hungry. So in all of my cases and what we teach our students is that like, we need to make sure that we have really good nutrition first in that management factor of stress feedback, because we need to have healthy cells for regeneration. So that's kind of the reason why it's there, is like there is no part of life that doesn't need some sort of input, because life is always giving us a feedback loop of like, what is the holding pattern you want to take? Is that healthy and natural and it's going to sustain you optimal comfort and function? Or do we come in and do a little bit of neuromuscular repatterning to kind of get you back onto a more homeostasis pathway?
I really love the explanation you've just given. You've covered such fantastic points. And I think we forget about nutrition very easily, and hydration. And in horses, I think I've recently heard that that's a bit of an issue in a lot of the stable yards, because hydration is an issue apparently, but to keep the fascia healthy and the body healthy, hydration is essential. I love the like mineral stations that people are putting out. If you follow the track guys who create tracks, I love that, like different kinds of minerals in the water. That's a thing that they're doing now. I think that's really interesting, and just that self-selection that horses will do when you give them the choice. So everything you've said now makes me think of the fascia, you know, the holding patterns, and fascia holds that posture. And the book, The Body Keeps the Score, a lot of that is happening within the nervous system and the fascial system. And that's, I'm really excited about that, because obviously our theme this year for the VetRehab Summit is the myofascial lines, and we're really going to be diving into that. So yay, I love it.
Yes.
We have a question here from Erica. Great book. So I'm assuming The Body Keeps the Score is what you're talking about. I love it as well. It's on my bedstand at the moment. I'm reading it. If there is a mind-body connection, does this mean that it's also a body-mind connection? I love that. Are therapies such as ESDR going to be available in North America? If so, what is research saying? Interesting question. So I think,
Yes, it's definitely a two-way feedback loop, right? And that's where sometimes we find clients have like that the best environmental management they can do. I love the track systems. I try to convince every client building a new farm to do it that way. But it's certainly, we can see emotional manifestations appear in the body as well in physical stress factors.
and I think it's really important to consider that we don't always recognize emotional stressors in horses. I think that there are so many things that we overlook because we don't consider it to be stressful, including in the way that we're training. We're teaching a
Mhm.
lot of horses to just cope with stress and trauma instead of becoming more confident in more difficult situations. And just that difference in forcing them to cope and to listen versus building their confidence in new environments can have a massive effect on their mental state and then on their bodies. So they absolutely go hand in hand. And that's one of the big kind of stumbling blocks I've come across with some patients, is that I can work on their body, but their mind is actually the problem. And then those holding patterns continue to come back because the triggers within their mental state and their environment are not being dealt with. So I can deal with the body all I want, but if the mind is not being dealt with, then that's not going to be, yeah, that's not going to hold. Um, can you tell us what ESDR is? Maybe you're familiar with that part. I'm not.
I'm not. I don't know
Yeah.
what she's referring to there. I don't know if she can pop that back in the chat. Maybe while we're waiting for that to
Yeah.
pop back in the chat. From the emotional perspective, that is one of the biggest things that with Equi-Bow in particular, we try to teach and offer like a consent-based physical connection with our horses, because
Mm-hmm.
if we are always like doing to them, we are not always going to see the same shifts within the body, both in a physical level and an emotional level. If the horse still feels like we are doing something to them, and there's a little bit of like a coming into the personal boundary aspect versus being the catalyst or the facilitator for like opening up the door to healing and shifting into that parasympathetic state where we're in rest and digest, restorative healing, versus in sympathetic where they're like, oh God, this new lady is here and she's doing a pokey thing or an ouchy thing in these regions. So it is very soft and consent based and open. And what we find is the body and the horses are quite amazing at knowing what they're able to shift and what they're not. So as we start to work with some of these patients, what we find is that we'll hit kind of an emotional layer when we're working with the body. And then that's where we're going to do a little bit of investigating to see like, okay, so perhaps we thought she or he was coping really well, but now we're getting to this stage where I can't get this region of the body to shift and change. And then from like an alternative health perspective, what kind of emotion or region is it's also tied to? From like a Chinese medicine, do we have like a heart center or a spleen center, or we have a chi flow issue? We can start to then kind of explore what other factors might be at play. And is there a reason that this particular horse wants to keep it? Like maybe we can't change a management style, especially for horses kept in a large stable environment or a boarding situation. Sometimes there's like a repetitive pattern that they're like, no, this is what my management team does. I need to have this coping skill. And so we have to be very cognizant of that and meet them where they're at, and then explore ways that perhaps we can shift it in the future, or does this particular horse need to move? And I think we so often forget that our horses are a prey species, and so it's very natural for them to just like adapt and be like in a cohesive relationship for their particular safety, and it can seem like they're doing really well, and at the end of the day, the nervous system could be in such a freeze state that they appear calm. And so, one of the big things that we explore with clients is that we can't guarantee what emotional layer is going to come up as we relieve some of the cellular traumas that are happening, because there is a two-way component to that. So, we always talk about behavior changes they want to watch out for, or communication changes. And it is quite beautiful and challenging for the human involved to see those shifts, because horses who perhaps were like never complaining, quote unquote, we start to facilitate some change in their posture and their body, and now suddenly their saddle that hasn't fit for potentially years is a trigger to them. And then that can look like a behavior to the owner of like, now they're being naughty, and it's like, well, actually we've opened up this therapeutic window to be like, how do you feel? Like, I'm here for your biofeedback to let me know, is this region sore, is it in a protective state, or are you ready to kind of communicate? So it is something that we also go into with owners of being like, are you ready for what is to come? And that fact that what's to come may look very different for each individual horse's journey.
I really love that the focus is on that feedback from the horse, and it's about creating the opportunity for them to communicate and be heard. And that is behavior that looks like behavior. So that I really like that. Erica, sorry, at red lights. Similar to EMDR in people to repattern trauma. Okay, so we'll have to look into that and come back to you, because neither one of us are familiar with that. But I can definitely look into that and then see how that would be applicable to our equine patients, if at all. Yeah, I think that would be good. Thank you, Erica, for your questions. It's great to have you joining us, even if it is at red lights. Okay, so let's talk a little bit more about how we can achieve neuromuscular repatterning. How are we going about doing that?
So there's a number of modalities out there, and when you explore them more at the deeper level, everyone is coming in and just finding a way to connect with the interface of the different fascial layers. We're basically coming in and trying to achieve connection with the tissue to get that sort of nervous system response to the different modalities that we're using, as far as physical touch or energetical touch, depending on some of the modalities that are out there. And it's because when we think of fascia and all of that hydration potential or lack of within all of that sort of interweb, I like to call it, for clients, is that nerve rich cells where we can come in and with the lightest of touch create a little bit of force on the cellular level that actually creates like a piezoelectrical charge. And that in itself will then bring the nervous system's awareness to that particular region of the body to say, hey, this is what's currently happening here. Is this how your optimal function is supposed to be? Or are you in a contraction state and not letting go? Or do you have an emotional cellular trauma here? And that might be what she's referring to, is emotional trauma stored within the tissues of the body. And that is a fascinating thing. And I'm not going to lie, when I was shifting from conventional to alternative medicine, it was quite fascinating for me to see the emotional response that we could get in our cats, dogs, and horses when we're relieving a fascial restriction. You can almost see some of them have like a PTSD like moment of whatever maybe happened. And it can be quite alarming, but it is also quite beautiful once you get through that sort of facilitated support moment with that particular animal, of the relief that comes. They've literally stored some of that emotional event in the tissue where it had an accident. And I know there's more and more research coming out all the time on the human side. And I think we can apply a lot of it to our animals. Obviously, they can't give us the same communication feedback of like, yes, this is what happened when I had my rotational fall. But you can sort of see the tissue kind of move back through some of those motions. And with our horses, we see some of that actually happen when we're doing limb work. You'll see some of them contort their joints at angles that they really shouldn't do, kind of in reverse of how the accident originally happened. And so it's interesting that if and when the body is ready, coming into those fascial regions where there's nerve-rich centers, bringing that nervous system's awareness to it, the brain is actually what's restoring the normal order. Clients always think it's fascinating that I say, I'm not here to do something to your horse. I'm here to say, in the haunches region, we have these particular muscle groups that are not firing correctly. I'm going to bring awareness to what is currently happening. And it's up to the brain to sort of reorientate itself to let go of a holding pattern, or to help facilitate like the actual neuromuscular function for that muscle to fire if it hasn't been firing. And so when we talk back to those repetitive motions, there's a lot of horses who are moving and carrying themselves at like 40 to 60% muscular function. Like they're just not activating a lot of regions. And so these are the creatures that you see are training and training and training, and they just don't have a top line, or they just don't have the quadricep support that they need. And it could be that in that region, we have nerve compression from muscles that are underactive. That's supposed to support the nerve so they have good feedback. And, or we have muscle spasm that's like also compressing the nerve. And we just don't have that feedback to the muscle to fire. So we're there just to get everything kind of turned online and then also down regulated if there's an overcompensation happening.
Yeah, I love that. It's at the end of the day, we're facilitating healing in the horse. They need to do the actual work that's going to make the difference. I like that. Those that have joined us online in the last few minutes, it's so great to have you with us. Welcome. Please let us know where you are, where you're from, and what you're interested in today's topic. We're chatting about neuromuscular repatterning in horses, and we're going to be talking a little bit about Equi-Bow. So can we talk a bit about touch and movement and how we're using touch for this and how we're using movement for neuromuscular repatterning?
So the touch is the first component that we have to sort of act with the nervous system interface, which we're going to use the fascia in this particular case to bring awareness into those regions to get that normal neuromuscular pattern to fire. Once we have that, what we're going to do is use the proprioceptive properties of the body to kind of re-loop that feedback loop to allow them to start to move back through their environment in a more normal way. So with as practitioners, that usually starts with just going back over for your palpation, reevaluating which areas of the body are now hydrating better. Like we can actually see fascial rehydration during a session. And it's actually quite fun because clients are usually noticing regions of fascial dehydration, and the coat will just be coarse or dull or a little lackluster. And these are the clients that are using every lotion and potion, I call it, to try to get that glisten or feeding all of the extra supplements. But at the end of the day, it's just the lack of microcirculation and hydration to that fascia region. So we can work on them and you'll literally see the coat just glisten and the hydration come back. And when we can see those areas rehydrating within the session, what we're going to then do is just invite the body to go back through some passive motion. So just introducing a little bit of tissue movement and contact, so a little bit light touch, sometimes similar to like a light touch massage, just to see how they're feeling. And then we're going to invite joints to go through that nice passive range of motion, because it's quite interesting to see how many horses feel like they can kind of live within this window of a shoulder movement, let's say. And then we do the releases, we get the lengthening back in the latissimus, we got the sling group able to elevate and move, and then we invite that shoulder to just go back through. You'll literally see the horses be like, my shoulder lives in this box. And then you'll just take it again, one more repetition with a kind of a Feldenkrais method where we're just introducing movement. And then we get a lengthening and we get extension and everything starts to move a little bit more. And you can literally see them shift back into that parasympathetic state and actually have a deep cognitive processing time where they're just like, whoa, my body just moved through time and space in a way that it hasn't been. And so we start with really simple proprioception of like, I'm just going to do passive range of motion. And then we literally take them for a walk. And I think the number of clients that are surprised that a first visit homework looks like hand walking for a day or two are just mind blown. But when we start to break it down for them and explain, you know, how the horse is actually supposed to walk, what those joints should do in time and space, so many realize their horses haven't been walking correctly. And so they're moving and they're functioning. We like to say functionally dysfunctional, like they're not in distress, but were they optimal? And then with that, we get the whole horse turnover because we've improved circulation. We've improved the biofeedback from the ground forces. We've got increased organ function then because everything's just online and active and rejuvenated. And with our horses specifically, I think so often we forget how important that caudal hoof is in the proprioceptive feedback loop and also the circulation. So when they don't have normal range of motion through the scapula or the shoulder or the elbow or in the hind end, if we don't have SI function that's healthy or hips and stifles, we're blocking circulation, we're blocking lymphatics, we can have nerve compression. And so they're literally functioning, but they don't have that biofeedback loop to know that they have no circulation and they're like literally moving on numb limbs. I see upper level meter 50 jumpers who can't feel their forehands, and it's fascinating and alarming all at the same time. But that shows up as these horses who have a lot of emotional anxiety. They have poor digestive systems. And that's because that referred pain and referred feedback loop can go both ways. So we're going to see the whole horse start to thrive more and that overall hydration just improve alongside organ function and mental health as well.
Sure. So much in there. I love it. Thank you, Caren. So I love that you spoke about light touch, because I think that light touch is so powerful. And there are many methods that are focusing on that lighter touch. So I'm glad you mentioned that. And with the Feldenkrais, I think one of the biggest eye-opening things that I heard when I started learning about it was that when we keep taking a joint to the end range of motion, we teach the body what its limitations are. We're continually saying, this is what you can do and only this. When we show when we're moving the body within its comfort, within its areas of comfort, we're allowing it to learn what it can do without giving it limitations, without giving it, that trigger of, oh, this is painful. No, if you stay within that comfortable area, you're teaching the body that it can move and be comfortable, which means that it will continue to do so and grow in how much it can do that. So I love those two things. Okay, we have a great question from Erica regarding the bit, right? So I was recently reading that the bit acts as a point of proprioception. Could you further explain this more? If it's too off topic, we can go into that in a private message or in a post afterwards. But do you want to chat about the bit and how that impacts the rest of the body as a point of proprioception?
Yes, absolutely. So we don't, in the teaching practice, the modalities I don't personally do bit fitting directly, but I will take a look at what clients are using as far as bits. And we show students some kind of basic factors to look for. And then we do have some pretty amazing bit fitters out there now in the world, which is great. And a lot of them actually do online Zoom consults too. So if you are in an area and you feel like, oh, that doesn't exist here, I do your research. There's a lot of wonderful professionals out there that are offering this service. And it does actually play a role in proprioception in that we quite often forget that when we have the interface of the tongue in itself is directly connected with the hyoid bone that is hanging inside your horse's skull. And through this series of muscular soft tissue connections and our fascial trains, that tongue connection is not only going to change how the lumbosacral plexus is working, but also then that's your hind end biomechanical function as well. And so it also just allows that whole horse feedback loop of contact and balance and movement, or in most cases, lack of. And we can actually block or create more discomfort or dysfunction. And if there's a challenge, the reason light touch is nice, and like why as riders, if we are going to ride with bits, we want to always have like the softest connection possible, is that the tissue can match force or go into a defense kind of mechanism where it's going to brace. And so if that is happening, you're kind of cutting off that neuromuscular feedback of like, we need to hold, we're not going to be supple and move through time and space quite the same. So if you are going down that avenue with bits, I really encourage you to continue. It's quite fascinating research that's out there, and there are more horses than not, especially in our thoroughbreds or our thoroughbred crosses in the warm blood category. A lot of them have tongues that are actually quite large for their actual mandible, and so they have a conformational fault that is like, we can work around it, but we need to be mindful that it's there. And so like contact for them in the mouth is going to be very different than a horse that has a lot of freedom of tongue movement and a lot of palate space.
You've explained that really well. Thank you, Caren. Really highlighting that connection from the mouth to the hind legs and that it has a massive impact on their movement. Thank you. Okay, so can you tell us a little bit more about specifically Equi-Bow and where people can learn about it?
So Equi-Bow is a sort of mixed modality. It's been, I think we're going into our 19th year. We were joking that Equi-Bow is now becoming an adult. So it was originally created by Cheryl and Simone. It was two lovely women who actually come from a human side of practice with craniosacral therapy, myofascial release, sports medicine, massage, etc. With a little bit of background, Simone actually comes with a radiologist perspective. So that's fun too, and looking at the body as a whole. And so it's a mix of Bowen-based soft tissue protocols as well as some cranial sacral therapy protocols, because we're going to have to meet the tissues and the bodies where they're at with some different techniques. We also have some deeper myofascial release protocols that we will use. And we do a lot of movement repatterning and Feldenkrais-like methods to help sort of bring back that proprioceptive change within the body. And so we have just started to launch some online courses. We, as many around the world, the pandemic brought some challenges. So we had to take our live teaching dates, which used to just be in Canada, and we now have moved to an online mixed modality or mixed teaching platform where we do online and hands-on. And in some of our recent discussions as a team, we've discussed the potential for professionals who already have an anatomy and physiology background or are trained in a different modality, that it may be something that we may launch to do just virtually and online for those that are international. It's going to be a little bit easier for us to take our live teaching dates internationally now that things are a little bit more normal. We did have some colleagues lined up in Australia and in the UK for 2020 before life changed completely. And we just haven't really gotten back on track with that since, because for us, this was always a very live one-on-one clinical application, palpation kind of teaching philosophy. And now we're doing the mix. The beauty with that is we've also been able to open it up to our horse owners and therapists who just want to learn a little bit more. So we have some pretty cool things launching into the fall here as we're kind of in back to school season here in Canada. And so those will be coming available soon. In the meantime, you can learn more about us at equibowcanada.com. We do have an Instagram and Facebook page. They are not very active. We have a very we like to call ourselves the nerdy bunch. As far as like clinical application, none of us are techie. So we have just recently hired some more youthful media team members, and those will be coming as well. And so I can definitely let you guys know when those online options are there, but there's lots of details. And for those willing to travel, we have live classes available in Canada and the US.
Awesome. That's amazing. Thank you. So another question from Caren. Caren, it's great to have you with us. Gelding scarring. What can this modality offer for that, for gelding scarring?
So we definitely work with gelding scars. I love that you first of all know that gelding scars are a thing, because a lot of people don't. So we have some beautiful soft tissue hands-on techniques for working around scar tissue in itself to break up some of those adhesions a little bit. Obviously, some adhesions are going to be permanent, but also the whole horse picture of that. So often we can get stuck on any kind of wound healing as being kind of that region that's there as an issue, but then think about what that pelvis did. And especially for our geldings, depending on your veterinary professional, was it a standing castration? Was this horse in lateral recumbency during the castration? How did the anesthesia go? Anytime we're anesthetizing a horse, there is going to be a catalyst of events that are going to happen in the way they go down, the way they get up. So when we talk about gelding scars, it's not just the scar tissue work itself, but we're also going to be like, how are those inguinal ligaments doing? What are the gluteals doing? What is the biceps doing? How is our lumbosacral region doing? Is that thoracolumbar fascia in a holding pattern because they kind of collapsed down or they didn't get up very well? So we treat the whole hind end as a whole, and then also being mindful of like, yes, this hind end just went through a surgical procedure, but then how did the forehand and midsection compensate? So post-castration visits are fantastic to get booked quickly when we can, but we can work on gelding scars in our mature and senior horses as well and still have an effect, because they potentially have adapted that holding pattern in the pelvis, which then changed their their resting posture, which then changed the way they move. So they are fantastic to work with. I have had a few cases where the tissue was quite traumatized depending on the particular event. The very rare case sometimes we'll go back to surgery, but we prefer, and I would say 99% of cases, we can do the work to relieve some of the tension in that region and get the pelvic ligaments happier and get the muscular functions better, that we don't have to go back to that.
Yeah, good. I love that. Thank you. I love that you brought up the compensation patterns that occur, because especially when something is chronic and you're dealing with a mature scar, there will be changes within the whole body as a result of that. So thank you. Great question, Carol. If there are any more questions from our listeners, if you're watching this as a recording, please pop them in the comments. And if we don't get back to you, you can always tag us as well, and that will make sure that we see it. But we'll be coming back to this broadcast in the next few days to make sure that we are answering any new questions and connecting with you guys. Caren, thank you so much. I think it would be great if we share the link to the Equi-Bow Facebook page and where they can learn about the courses in the comments as well, so that anyone who is interested can jump on board and do that with you. And then if you guys are interested in learning more about myofascial kinetic lines and how those are working and how we can work with them, that is the theme for this year's Vet Rehab Summit on the 10th and the 11th of November. It is going to be amazing. Ticket sales are still open and they are still discounted at $100. There's $100 discount on them. So right now is the time to buy a ticket if you're going to buy a ticket. That discount is only for a few more days, and then the price goes up to the normal ticket cost. So definitely get your tickets and join us at the Vet Rehab Summit this year. All right. Thank you for your time today, Caren.
You're very welcome, and this is a pleasure. And I love that the world is kind of advancing in all the connection, like the fascial trains finally being documented in our equine patients, and our canine patients are as well. It's really nice for those cases where we feel like we're hyper focusing on an issue, forgetting the global connectivity of it.
Yeah, I completely agree. I'm very excited about the canines because that is not something that the small animal world is talking about, and they need to. They need to know about
It's coming.
So it's, yeah, I'm very excited. The Vet Rehab Summit is going to cover both the canine and the equine lines, because those canine lines haven't been published yet, but the researchers have done the research. It's just not out there yet. So I'm really excited. Awesome. Thanks, guys.